Thank you, Cian, and thank you for your leadership in FIGO. We accomplished a lot under your leadership. So I'll talk to you today about hyperglycemia in pregnancy and the FIGO HIP, we call it HIP, hyperglycemia in pregnancy roadmap that we plan. So here is actually the HIP challenge. What is the HIP challenge? We have over almost 130 million deliveries per year, every year. Out of this, we have about 21 million complicated by hyperglycemia in pregnancy. Only 3 to 4 million are detected and treated, and we don't have any idea how many receive postpartum follow-up and care. And that's for us now today the biggest challenge, because short-term complications, we can deal with them. We already know how to deal with them. But the long-term implications of having GDM or any other pregnancy-induced complication, this is where we have to put the money, our money in, because those ladies will have a non-communicable disease in 5, 10, or 15 years following this pregnancy. So this is our challenge. And that's what Professor Purandare alluded to. We just had a meeting in Sri Lanka, South Asia. Have a look on these countries, India, China, Pakistan, Indonesia, and Bangladesh, and we'll add to it Nepal and the Maldives. In these 6 countries, and I'm taking out Brazil and Mexico, Latin America, we have over 55 million deliveries, which means about half of global deliveries are happening in 8 countries in South Asia. And that's where we have to put our money in. If we'll have Brazil and Mexico, we already have 65 here, but adding the others, we are over 50% of the global delivery population. So why FIGO and why the GDM initiative? Because FIGO brings together professional societies of obstetricians and gynecologists. And we are all obstetricians and gynecologists, and we have to obey, let's say, I'll call it the rules, but the guidelines of FIGO. We have 130 member societies, and FIGO's vision is for women of the world to achieve the highest possible standards of physical, mental, reproductive, and sexual health being throughout their lives. So FIGO identified GDM, or hyperglycemia in pregnancy, as a work for FIGO to be done, and started the initiative in December 2013. And I was appointed to lead this working group. We created a working group that actually was composed of about 20 members, leading perinatologists and some diabetologists as well, that were supposed to come up with evidence-based, practical, and pragmatic standards of care protocol, guidelines. The aim was advancement of women reproductive health and rights, promotion of newborn and child health, and especially, and I repeat it, especially prevent NCDs, non-communicable disease, which means type 2 diabetes and other cardiovascular and other diseases, which means FIGO joined the game. The whole problem related to GDM started in 1964. You see it here in blue. 1964 came out the diagnostic criteria by Sullivan and Mann, and since then we are in dispute because everybody is using a different method how to diagnose it, how to screen. Then in 1989 the St. Vincent Declaration came out, where they came out with the declaration that they want to equal the outcome of normal pregnancy to that of a diabetic pregnancy. It failed. Why did it fail? Because the meeting was organized and chaired and endorsed by WHO and IDF, the International Diabetes Federation. No obstetrician was present there. FIGO was out. FIGO was out of the game. So you can't actually pose and lead and guide obstetricians and gynecologists by guidelines that are coming from not our profession. WHO are the strongest organization, medical organization, but still they are not actually working with us in obstetric gynecology. So it was there in the open. Then another landmark was the HAPO study, as you see, 2000 to 2008, because the HAPO study provided the evidence-based data needed to define what is normal. They defined what is normal glucose in comparison, or that leads to abnormal fetal and neonatal outcome. So that was the definition of normality. And then FIGO joined the game. I called it FIGO joined the game. FIGO started the HIP initiative. It started with Professor Arul Kumaran and continued with the strong leadership of Professor Purandare. We started, as you see, in December 13. We finalized the first part of the working group process in October 2015. I'll show you what we produced. And we started the second phase in November 16. It will finish it in October 2018 at the Global Congress of FIGO in Rio de Janeiro. So that's the WHO endorsement of the criteria that were actually produced by the International Association of Diabetic Pregnancy Study Group. Then IDF approved it, endorsed it in 2014, and then we produced our working group, the FIGO working group, produced the guidelines. And the guidelines actually came out in October 2015. We published it in the International Journal of Obstetrics and Gynecology, and since then it's in the air. And we are trying now to push the agenda to endorse it by everybody. I'll show you, it's already endorsed by most of the societies, global societies. We came out with this infographic that you see on the right side, and I'll show you a bit later. In the guidelines, we produced what we call FIGO boxes. You see them in green. I am not going over them because it will take me an hour to go through the boxes, but whoever wants to get a printed version of the guidelines can get it on the website. I'll show you how to get it on my last slide. So actually we came out with these FIGO boxes that actually tell you do and don't do. You have everything. It's a cookbook. So we produced it for every aspect that deals with the management of a diabetic lady. Pre-pregnancy, during pregnancy, and postpartum. The only thing that I would like to spend a bit more time here is the diagnosis. For the first time, we decided on one test only, universal screening diagnosis, call it screening or diagnosis, using a 75 grams like you do post-pregnancy, and using fasting 1 hour and 2 hours. And as you see here on the lowest one, this is the basic minimum that you have to do, between 24 and 28 weeks to perform an OGTT. But in fully resort countries with high ethnic population at risk, you have to perform the OGTT already at the first trimester, as early as you book your patient. In fully resort countries without high-risk population, it will be enough to do a fasting plasma glucose, random blood glucose, or hemoglobin A1C. Again, at the first visit during pregnancy. But what happens in the real world? India. Let's take, for example, India and China. In India, we have 30 million deliveries per year. It's unbelievable. The whole United States is 4 million deliveries. The whole Europe is about 4 million deliveries. India with 30 million deliveries. Indian pregnant ladies can't come to the clinic in a fasting state. There is no way. They have to travel sometimes 2 hours, 3 hours to the clinic, so there is no way that they come fasting to the clinic. So the Indian FOXI, the Federation, and DIPSI came up with evidence-based, applied enough evidence-based to show that you can use the 75 grams not in the fasting state and to use only the second hour. Exactly like the second hour in the full OGTT, and they came out with enough evidence to show that their outcomes are equal to the same outcomes that we have with the full diagnostic test. In China, for example, with about 18 million deliveries, 18 to 20 million deliveries per year, they have a screening test. They can use the fasting. And again, they got a lot of resources from the World Diabetes Foundation, hundreds of thousands of dollars to run studies, very big studies. About 750,000 patients were screened in China, and they provided evidence that fasting will be good enough to screen their patients, and only those that are positive to proceed with a full diagnostic test. So these are our guidelines. We produced them fair in English. You see 4 slides, and in these 4 slides, you actually have everything that you have to know and to show your patients or the other care or educate the other caregivers how to use them. We then produce this infographic already in French, in Spanish, in Chinese, and we already have them now in Italian, in Bulgarian. They are being translated now to Greek. So we'll have them in every language that works with FIGO. Whoever is present here and wants to translate it to his own language is more than welcome. We'll give you a hand. Then these guidelines were endorsed and approved, and you see all the associations that approved it. Then we actually presented it and got the endorsement from these two leading organizations in October and December 2015, and I called it kind of synonym to the St. Vincent Declaration, the Vancouver Declaration. But this is a true declaration, because the declaration came from FIGO in October 2015 at the Global Congress of FIGO, and 2 months later, again in Vancouver at the IDF Global Congress. About 15,000 persons were there at the IDF Congress. So FIGO and IDF, the two organizations that actually deal with diabetes and with pregnancy, approved them there. Their General Assembly in Vancouver in October and in December. So we can call it the Vancouver Declaration. What do we do now? We started our second phase in January 2016, and the main focus now on dissemination. We have to disseminate the guidelines, and we have to push over the agenda. So this is the new working group. We'll be working in 3 subcommittees: capacity building and training, awareness and advocacy, and research and implementation of science. These 3 subcommittees are producing a lot. Since then, we produced a lot, many publications, editorials, and I'll show you. We work with many other NGOs, and we are pushing the agenda of advocacy in awareness with leading NGOs like Women Deliver, like MSI, like JH-FIGO, and they are all enthusiastic to push the agenda of HIP. FIGO took a leading part now in perinatal medicine. About 4 or 5 years ago, it was kind of non-existent in FIGO. And again, I would like to push forward the idea here that it started with Arul Kumaran and now continuing with C.N. Purandare. All those perinatal leaderships and committees and working groups that you see here actually started about 3 years ago. The HIP Initiative Working Group, the Good Clinical Practice in MFM by Giancarlo Di Renzo, Care of Mothers in Infant During Labor and Delivery, Roberto Romero, Safe Motherhood by Gary Visser, Maternal Nutrition, Mark Hanson, Preterm Labor, Jolie Simpson, and Intrapartum Fetal Monitoring, Diogo Aires de Campos. So we have a leadership, a very, very strong leadership under the FIGO management that now leads FIGO towards perinatal medicine. And I'm very proud to be part of it. We had a lot of presentation. That's only a partial list here. I'm not going through it. But we presented the guidelines and our initiative globally, all over the world. We updated the website. There is a bi-monthly email updates, feature in paper newsletter, feature in a monthly newsletter, and we are providing more and more in large meetings and congresses. This is our roadmap of declarations. We started to actually sign declarations in every region that belongs to FIGO. The first one, and maybe the most important one, is the SAIDIP region, South Asian Initiative for DIP. And in September 2016, we had a meeting in Colombo, Sri Lanka. And just to remind you, South Asia, 8 countries, 8 nations, with over 55 million deliveries per year. It's 11 times or 12 times more than the whole Europe. It's unbelievable. So we had a declaration. We signed the HIP declaration, actually endorsing the FIGO guidelines in Sri Lanka with the Minister of Health of Sri Lanka. I'll show you. Then we'll continue with Africa. A week ago, exactly a week ago, actually 6 days ago, a week ago, exactly, it was Thursday, we signed the Barcelona European Declaration, and having Professor Tahir Mahmoud, the president of EPCOG, and myself, I am the president of the EAPM, we managed to bring to a consensus, finally, Europe. So all the European countries will have to follow up the FIGO guidelines. Then we'll continue in Asia next year, Greater China, September this year, FLASOG, Latin America, Gulf and MENA region in Abu Dhabi, December 2017, and we'll end up during the Global Congress of FIGO in October 2018 with the Global FIGO Declaration. I believe, CN, that we'll have to make quite a big celebration there and to come out with press release or whatever FIGO is doing to announce this event. This is the SciDeep Colombo Declaration. You can find it already on the website. It's there. This is the signing of the HIP Declaration. CN Purandare, myself, and the rest of our SciDeep members. The Minister of Health of Sri Lanka is signing the declaration. Then we went to Barcelona, and as I said, 6 days ago we signed the Barcelona Declaration on Hyperglycemia in Pregnancy. This is the Spanish Minister of Health signing the declaration 6 days ago. So we have now the South Asian and we have the European declarations. We'll have a joint symposium with IDF, the International Diabetes Federation, in December 2017 with a very strong representation by FIGO, myself and CN Purandare, and we'll have Shaukat Sadikot, the president of IDF, and the rest members, leading members of our working group will present the guidelines. We'll have the Greater China meeting in October 2017. Then we already, in the process, we submitted it. It's going to be published very soon, a commentary, editorial, in the British Journal of Obstetrics and Gynecology. We were invited, actually, to present this editorial. This came out a week, actually, less than a week ago. In the Italian literature, we produced an editorial in English, followed up by 2 actually clinical opinions and an editorial in the Italian language by the leading Italian perinatologist. We are producing now editorials, commentaries in many other countries. We are doing it already. Italy is done already. The Russians are producing one, Polish, Greece, and Brazil. And again, whoever is present here and wants to work with us and produce a declaration in his country, in his own language, will give you a hand. We are coming out with a textbook under FIGO. We call it the Omics and Perinatal Medicine, Innovative Approach to Pregnancy Complications and NCD. We'll come out with it in about a year from now. It will be under my HIP working group, and we'll have here leading persons, all of them working in pregnancy-induced pregnancy complications, and I would say the latest innovations, the latest technologies that deal with prediction of pregnancy-induced complications and some preventive measures. We are working now on an establishment of an Institute for Perinatal Health Research. It will be a unique perinatal health center because we are planning to have here, planning to form a consortium starting with 4 leading departments in Europe, with about 6 leading laboratories in Europe, and the vision is to establish an institute in the area of perinatal and maternal and fetal health research, recognized nationally and internationally as a leading center that will contribute to sustainable improvement in the health of the future generations. We are planning to establish in this FIGO Global Perinatal Research Network first trimester clinics, a perinatal biobank, and the perinatal biobank will deal with any tissue that actually we can work during pregnancy and postpartum. It can be feces, blood, of course, saliva, amniotic fluid, cord, placenta, and after delivery it will, of course, continue on one arm with the mother and the second arm with the offspring. It will be an international academic research, education, and training center. We'll continue the educational part with the Price School in Florence. It will be a diagnostic development center, mainly leading towards simple and cheap tests for low-income countries. We are going to deal with big data that actually belong or deal with perinatal medicine, and they will be, of course, connected to the perinatal biobank. We'll deal with health economics. Health economics are an extremely important part of our work, and we'll work, of course, with technology transfer. Those are the 4 collaborating hospitals that we'll start with. Rabin Medical Center, my center, the Clinique de Barcelona with Professor Eduard Gratakos, the Azienda Ospedaliera di Careggi, Florence, with Federico Mecacci, and the Medical University of Warsaw with Miroslav Wiglosz, who is now director of the university and the president of the Polish Society, right? Yeah. And the collaborating perinatal research laboratories that already started collaboration, but it will be more formal, will deal with small or microRNA, microbiomics, metabolomics, genomics, and the placenta. Again, I repeat, whoever is interested to join this effort, please get in touch with me. That will bring an end to my lecture, and here you can find on our website, www.figo.org, you can read and get all our publications. Thank you very much.